My name is Dr. Jason Shimard. Today I want to focus on just some standard information on type 2 diabetes that you may think you understand, but that's really not being told to you. And so first thing I want to do is just go over some traditional numbers. Some of these numbers like I have here with the American Diabetic Association, they're a little bit old, but it's going to give us some data. And the reason why I want to show this data is I just want you to understand the significance of what we're dealing with in regards to type 2 diabetes. So if we look at here from the American Diabetic Association, and just so you guys know, there is some great information on this page, but there's also some stuff on here I'm going to be talking about that's not that great either. But statistically, they have some good numbers here. We can see we have roughly 1.2 million Americans are diagnosed with type 2 diabetes on a yearly basis. So this is a big problem that we have going on here. Statistically, it's massive. More importantly, how it's impacting the financial situation, which we'll talk about here in a minute. 11.6%. This is actually low. You can see here. This is 2023. If you guys can see that there, it's bigger. Yeah, so we can see here 2023's numbers are actually a little bit older. This number now is roughly about 15% of the population. So it's increasing on a yearly basis. The numbers are staggering. It is playing a major role. And roughly 97.6 million, again, this is outdated information as well. We now know roughly about 50% of the population now is dealing with pre-diabetes. So this is a big issue because I always like to say to my patients when I talk to them, like, pre-diabetes is like pre-pregnancy. How many of you ever had pre-pregnancy? Those are the women in the audience. That doesn't happen, right? You either are or you're not. So what pre-diabetes means, and I'm going to define this in other videos you can watch later on, is essentially an indication that things are starting, the snowball is going, you're just not at a place yet where it can be fully diagnosed as a diabetic condition. So let's talk about some of the things I want to discuss in regards to diabetes today. The first one I want to discuss here is the risk factors, right? We commonly know, this is the main one people talk about on a regular basis, is this risk factor here, which is this extra weight, right? Now, let me kind of go a little further because people are saying, well, obviously weight is a risk factor for diabetes, and you're 100% right. But the way I want to challenge this today is, how many people do you know right now that are significantly overweight, even some would call obese, and they're not diabetic? The reality this happens more often than not, and what's even crazier is that we have people who are super thin, and I can tell you a story about this later on if you're interested, super thin, 120 pounds, 130 pounds, not overweight at all, and they're full-blown, out of control diabetes. So the point of this conversation is that the American Diabetic Association and the medical industry is talking so much about weight and how big of a problem it is. And again, I'm not saying it's not a problem. There are multiple health risks if you're overweight, and you shouldn't be overweight, but it's not the cause of your diabetes. There are so many other indicators that will increase the risk of type 2 diabetes, and weight can be a potential risk factor. But if your belief is that if you just lose weight, and if you're being told this, that if I just lose the weight, your doctor says 30 pounds, 40 pounds, 50 pounds, and that's going to reverse your diabetes, you're going to be sorely mistaken at that situation there. Now, again, if your goal is to lose weight just to help improve your overall health, do it. And I suggest you do that. But if your goal is to lose the weight to help reverse your diabetes, you're going to lose the battle. And you're going to be very frustrated, and you're going to be a skinny diabetic. And not a happy situation. Going back to your doctor, and your doctor's going to be scratching their head saying, well, you've done everything you're supposed to be doing, keep on taking your medication, right? And the next one we talk about is going to be food. Now, this is what I want to spend a little bit of time on here because this is very important. Now, the first thing I want you to understand is that you should be eating a good quality diet, right? The standard American diet right now, also referred to as what? SAD, right? Because it's a SAD diet. It causes a lot of issues to a lot of individuals, is terrible. Most people have no education on what they're eating. There's a ton of things out there in the research, the news, talking about all these completely horrible toxic foods that we're ingesting. Just going to the grocery store, and because it's on the shelves, doesn't mean it's healthy. So you're gonna have to become educated in the way you're eating. But the purpose of what I'm discussing today is that if your belief is that if you just change your diet, like if you had a horrible diet, let's just say you were just not paying attention to it, you're eating a lot of sweets, refined sugars, eating fast food on a regular basis, a lot of sodas, Of course, you need to change your diet. That is a foundation. It's like living in your home and think you're going to make your walls of your home structurally sound when the foundation is cracked. That's never going to be the case. Your food has to be in the right place. But let me be honest with you. If you only change your food and your intention is that by changing the way you eat, it's going to reverse your diabetes, that's not going to happen. You see, you can't reverse diabetes at all unless you make the changes the way you eat. But you're not going to fully reverse your diabetes by just eating a certain way. And if you look at here on this scenario here, I love what the American Diabetic Association is saying here in the sense that you need to make some changes in what your current dietary recommendations are. I want to stay with the white. But here's what I don't like. You see this right here? The largest one there is non-starchy vegetables. Well, here's the deal. It doesn't matter if it's a carbohydrate or a vegetable, it's all carbs. All vegetables are carbohydrates. Now, there's obviously better ones than others. Of course, we know like things like breads and pastas and cakes and cookies are terrible carbohydrates, terrible types of foods. And there's good quality non-starchy vegetables. But the reality is this right here should be there. That's where this should be. And that specific area right there, we should have a larger amount of high protein, high quality fats in the larger group, and it should be a smaller group with a non-starchy and some carbohydrates in there as well. This is important because if you're being told the wrong information, you're going to be eating these types of foods, expecting this result, and you're like, again, not getting anywhere, right? So you have to have a strategy in place. You have to have an information that's going to be specific to your needs, customized. Because the reality is this, when you go see your doctor and you're diagnosed with type 2 diabetes, what are they going to tell you? Change your diet, exercise, lose weight, in some cases take medication. So right now at this specific stage, at your scenario, what are you supposed to do? How are you supposed to be eating? You can go to the American Diabetic Association and start following some of their recommendations. And again, I like a lot of what they're saying. There's just slight tweaks that need to be done because the information is not the full best for your ability. Plus, on top of that, is it always going to be best for you? Right? The reality is you have to understand what's best for you, which needs to be customized. What type of food should you be eating? The quality of the food. Being educated on reading the labels. Being able to understand the way you should be cooking it, the type of oils you should be using, etc. There's a lot of information out there you need to find out, either by talking to your local nutritionist, or if you want to hire somebody, or just finding someone like myself who takes an individual who has a diagnosis like diabetes and takes them through a process to identify specifically what is causing their diabetic condition. And again, we'll go over a lot of that information. Make sure you come back to watch my videos. We're going to go over a lot of details of how we identify what is truly causing someone's diabetes, putting the right nutrition plan in place, how they should be exercising, which is a whole different video on exercise as well. But the specifics that I want to talk about today is that when you're dealing with diabetes, the old strategy of just eating better, right? Going from not eating refined sugars to eating less carbs, that is not going to fix your diabetes. By just losing weight, that is not going to fix your diabetes. And by exercising, these are not going to reverse your diabetes. Will they help you lower sugars? 100%. But you're going to learn as you go through the journey of our videos, we're going to be showing you that reducing sugars is not reversing diabetes. Reducing sugars may make things look better on paper, but it's not fixing your overall problem. It's not identifying your overall problem, and to make sure that we're really focused on your specific needs because you are an individual, you have specific genetics, and it has to be customized to your specific type of diabetes. Just because you have a diagnosis, a box of type 2, doesn't mean all type 2 diabetes is exactly the same. There's completely different mechanisms that are involved that need to be addressed. So I'm going to invite you to stick around, to stay on this page, like our page. Make sure you push this out to as many people you know that have type 2 diabetes who want to be educated and learn more about what they can do to change their lives for the better. All right, guys, make sure you join us on our next video. We'll be dropping that in the week to come. Take care.